Have you ever wondered why diabetes is such a prevalent disease in today's society? Around the globe, millions of individuals grapple with this health condition, which not only affects their physical well-being, but also significantly impacts their lifestyle. It's a silent adversary, often creeping in unnoticed, and before you know it, it's become a part of your life. Diabetes isn't just one disease. It's a complex web of different types, each with its own unique causes and risk factors. Some people are born with it, some develop it over time, and others might be more susceptible due to their lifestyle or genetic predisposition. This video aims to shed light on this often misunderstood health condition. We'll delve into the different types of diabetes, unravel their causes, and identify risk factors. More importantly, we'll talk about how to potentially prevent it, because understanding is the first step towards prevention. Stick around to uncover the mystery behind this common but often misunderstood health condition. Did you know there are different types of diabetes? Let's dive right into unraveling the three major types: type 1, type 2, and gestational diabetes. Let's start with type 1 diabetes. This is an autoimmune disorder where the body's immune system attacks and destroys the insulin-producing cells in the pancreas. This results in high blood sugar levels, as there's no insulin to ferry glucose from your bloodstream into your cells. It's often diagnosed in children and young adults, hence its former name, juvenile diabetes. However, it can appear at any age. Next up, we have type 2 diabetes, the most common form of diabetes worldwide. Unlike type 1, where the body doesn't produce insulin, in type 2 diabetes, the body does produce insulin, but either it's not enough or the body's cells resist it. This insulin resistance means glucose builds up in the blood instead of being absorbed by the cells, leading to high blood sugar levels. While it's more common in adults, it's increasingly being diagnosed in children due to lifestyle factors. Finally, we have gestational diabetes. This type only occurs during pregnancy. The hormones produced during pregnancy can make a woman's body less responsive to insulin, resulting in high blood sugar levels. The good news? It usually resolves after childbirth, but it does increase the mother's risk of developing type 2 diabetes later in life. Though different, these types of diabetes do share common ground. They all involve insulin, a crucial hormone for regulating blood sugar, and they all result in high blood sugar levels if not properly managed, but they each come with their unique set of challenges. Type 1 requires constant management, type 2 often calls for lifestyle changes, and gestational demands careful monitoring during pregnancy. So whether it's type 1, type 2, or gestational, each type of diabetes has its unique characteristics and challenges. As we move forward, we'll delve into the causes and risk factors associated with these types of diabetes, so stay tuned. Now that we know the types of diabetes, what triggers this disease? Let's dive into the causes and risk factors for each type of diabetes. Starting with type 1 diabetes, it's primarily caused by an autoimmune reaction where the body's defense system attacks the insulin-producing cells in the pancreas. This process usually leads to a total loss of insulin in the body. While the exact reasons behind this reaction are still being studied, it's believed that both genetic and environmental factors play a part. Now, let's talk about type 2 diabetes, which is more common. Here, the body either resists the effects of insulin or doesn't produce enough insulin to maintain normal glucose levels. Obesity is a prime risk factor, as it causes increased levels of fatty acids and inflammation, leading to insulin resistance. Sedentary lifestyles and diets high in processed foods and sugars also contribute to the development of type 2 diabetes. Genetics play a significant role in both types of diabetes, but particularly in type 2. If you have a parent or sibling with type 2 diabetes, your risk of developing the disease is higher. Additionally, certain ethnic groups, including people of African, Asian, and Hispanic descent, seem to be at a higher risk. Gestational diabetes is another form we should discuss. This type occurs in pregnant women and is likely caused by hormonal changes that make the body resistant to insulin. The risk factors include a family history of diabetes, obesity, and having given birth to a baby weighing more than 9 pounds. There are also other risk factors that apply to all types of diabetes, such as age. As you get older, the risk of developing diabetes increases, especially after the age of 45. High blood pressure and abnormal cholesterol levels can also increase the risk. Understanding these causes and risk factors is a stepping stone to effective prevention, so it's crucial to be aware of them, not just for yourself, but also to spread awareness and help others understand this complex disease. So how can you prevent diabetes or manage it if you already have it? Preventing or managing diabetes doesn't have to feel like an uphill battle. It's about adopting a lifestyle that promotes health and wellness. Let's delve into the strategies that can help us ward off this condition or manage it effectively if it's already a part of our lives. Starting with type 1 diabetes, prevention can be tricky because this type is often caused by factors beyond our control, such as genetics and environmental triggers. However, regular medical checkups can help detect early signs and symptoms, leading to prompt treatment and better management of the disease. Type 2 diabetes, on the other hand, is largely preventable. A key strategy here is maintaining a healthy diet. Consuming a balanced mix of nutrients can help regulate blood sugar levels. Include whole grains, lean proteins, fruits, and vegetables in your meals. Limit your intake of processed foods and sugary drinks, as they can cause spikes in blood sugar levels. Alongside a balanced diet, regular physical activity is crucial. Exercise helps maintain a healthy weight, which reduces the risk of developing type 2 diabetes. Aim for at least 30 minutes of moderate intensity activity, such as brisk walking 5 days a week. If you're new to exercising, start slow and gradually increase your activity levels. Gestational diabetes, which occurs during pregnancy, can also be managed effectively. Regular prenatal checkups are vital as they allow healthcare professionals to monitor and manage blood sugar levels. A healthy diet and regular exercise during pregnancy can also help prevent gestational diabetes. Now let's talk about prediabetes. This condition is a wake-up call and should be taken seriously. Prediabetes means your blood sugar levels are higher than normal, but not high enough to be classified as diabetes. The good news is that it's reversible. By adopting a healthy lifestyle, you can prevent the progression to full-blown diabetes. Regular checkups are a common thread in all of these prevention strategies. They are crucial in detecting any early signs of diabetes and initiating prompt treatment. Remember to monitor your blood glucose levels regularly, especially if you have a family history of diabetes. Also, it's worth noting that stress management plays a significant role in diabetes prevention. Chronic stress can affect blood sugar levels, so it's important to incorporate stress-reducing activities into your routine, such as yoga, meditation, or even a relaxing hobby. In conclusion, diabetes prevention is about maintaining a healthy lifestyle. This includes eating a balanced diet, exercising regularly, managing stress, and having regular medical checkups. If you're at risk or have been diagnosed with diabetes, work closely with your healthcare provider to develop a management plan that suits your lifestyle and needs. Remember, prevention is always better than cure. Taking these precautions can make a world of difference. Diabetes might seem like a daunting disease, but knowledge is power. In the past few minutes, we've walked through the labyrinth of what diabetes is, its various types, the causes, and risk factors. We've also delved into the powerful tools at your disposal to prevent and manage this disease. Let's take a moment to revisit these key points. Diabetes, in essence, is a metabolic disorder characterized by high blood sugar levels over a prolonged period. It comes in various forms, with type 1, type 2, and gestational diabetes being the most common. Each type has its unique causes and risk factors, ranging from genetics to lifestyle choices and even pregnancy. The causes of diabetes may be diverse, but the underlying theme is clear: a disruption in the way our body processes sugar. It's essential to remember that while some risk factors like age and genetics are out of our control, many others are not. Lifestyle choices such as poor diet, lack of exercise, and excess weight significantly increase the risk of developing diabetes. Prevention is always better than cure, and with diabetes, this couldn't be more accurate. Adopting a healthy lifestyle is a powerful defense against this disease. Regular exercise, a balanced diet, maintaining a healthy weight, and regular checkups are all crucial components of a preventative strategy. It's important to remember that knowledge isn't just for personal use, it's a tool that becomes more powerful when shared. So let's take this understanding of diabetes, its causes, prevention, and management, and share it with our friends, families, and communities. The more people are informed, the more we can collectively work towards a healthier future. Diabetes is a significant health challenge, but it's one that we can manage and even prevent with the right knowledge and lifestyle choices. So, let's not let it daunt us. Instead, let's arm ourselves with understanding and face it head on. With this knowledge, you are well equipped to take charge of your health and prevent diabetes. Stay healthy, stay informed.